All right. Well, hello, everyone, and welcome to our first interview for Pest Defense regarding state school IPM and pesticide reduction laws and policies. We're very excited to interview Veronika Carella, who is the legislative director for the Maryland Children's Environmental Health Coalition. Thank you, Veronika, for joining us. And I just want to start off with a general question of if you could state a little bit more about your work and how it's involved with school IPM and pesticide reduction policies.
Okay. Well, I am a health and environmental issues advisor and children's advocate, and I left the corporate world to address the issues of children's health and protection after my own children were injured in their public elementary school in Maryland. And I realized that this was a national problem and there was no way to hide from the issue. So I decided to become a content expert on this. And when my children's school system told me back when they were being injured that they did everything that they were legally required to do, I informed them that I would spend the rest of my life making sure they were legally required to do the right thing. And that was my introduction between 95 and 97 to children's environmental health. So I do most of my work pro bono. I came up through the PTAs, both at the local, county, state, and as an advisor on these issues at the national level over the years. And I worked with the Maryland Children's Environmental Health Network, was a group I have to say that we're very proud of. We lost funding in 2019, but we worked on issues of children's and actually the Maryland Environmental Health Network worked on everything with a specific focus on children. But I also work, besides the think tank that I'm the legislative director for, I am the school IPM liaison for the Maryland Pesticide Education Network. I have worked over 20 years with Claire Barnett with the Healthy Schools Network, and I'm a national advisor with the Coalition for Healthy and a Coalition for Healthier Schools member. And they're based out of New York, but they work nationally. And I'm a member of the Northeast School IPM Working Group, originally for the School 2015 project, and it went to 2020 project. So I am a charter member and continuing member of the Northeast School IPM Working Group, and our work is posted on the Cornell website, the Cornell IPM website. And I did serve in the state of Maryland. We have commissions that are state mandated. So you have the legislature, you have the judiciary branch with the attorney general, and then you have the state agencies or the executive branch. And to keep them all in sync and talking to each other, our state puts up these commissions that are state mandated and have certain duties per statute. So the governor appointed me back in 2008 to be a representative on the Children's Environmental Health and Protection Advisory Council. And I ended up serving 3 4-year terms. So I served through 2020, and I continue to work with them as a former commissioner on their work groups and at all their meetings. And I also was assigned, Maryland back in 2017 put together a work group called Health in All Policies, which is desperately needed with IPM because Health in All Policies talks about any decision that you make, you have to consider the impact to health and the environment in that decision, whether it's permitting or IPM. So the state of Maryland put a work group together where we would go through all the laws and figure out where the laws actually hurt health or damaged health or the environment. And that really shone a light on the weaknesses in our IPM system because most of the findings that came out from our group, and I was the CPAC liaison to that work group, related to weaknesses in the IPM law. So that was a good exercise and got CPAC more and more interested in the issue.
Right. A long list of experiences with IPM. Thanks for that. Just at the start, that review that you mentioned of school IPM laws, first off, could you just, is that review publicly available
Oh, yes, yes. And I will send you the links to that. The report was made final and all those findings were made final. So, would you like to know, is this asking me about like the background of the law?
No, I just want to know where that's available, and we'll make it available
Oh,
to
yeah,
the audience. Yeah.
right, right.
Great.
It's at
Yeah,
the
so
.gov website.
great, thank you. And the reason why we brought you on, you have all this experience, but we want to talk about different state laws, and in specific, the Maryland 1997 school IPM law. I'm assuming you had some sort of role in implementing it or proposing it. And if you did, could you clarify that role and what the motivations were behind developing that law?
Okay, so I was a parent of pesticide injured children at the time when this law, we were trying to pass this law. So between 1994 and 1998 is when we were working on the school IPM laws. I didn't experience the issues until 1995, but by 1997 had enough concern that I testified at the original law, and then the update in 1998, which expanded the law to the grounds department. And during those 4 years that it took, our biggest opposition was the Department of Agriculture, who was very opposed to the law. And when the law did pass and they published their 8 manuals, they stated that even though we had the law, that these protections were voluntary, when in fact they were mandatory. And these are still the inaccurate manuals that we have on the website for training, more than 20 years later. So I believe we finally had success in 1997 because in my county alone, and in Maryland, schools are, the school districts are by county. We had over 400 children on something called home and hospital care, meaning they could be educated anywhere except in a Maryland public school. And the reason was that most of them were if they entered the school, they got sick. And so we had 400 kids on home and hospital care in 1997 with private tutors paid for by taxpayer money. And we began to realize that if you have all this is enough kids to build a whole school just to house the kids that can't go into the regular schools. And that was one of the big reasons that we finally succeeded, because we had all of this evidence of children that could no longer enter a building, that where the practice in our county, as well as many other counties, was to just do baseboard spraying once a month of chlorpyrifos, which is Duraspan. It's an organophosphate poison. They would just come in once a month for over 10 years prior to us entering the school system and do baseboard spraying. And all of that pesticide just accumulated. And we had kids that were never asthmatic or diabetic or have these other issues. And as soon as they entered the building and were there full time, we had a spike in asthmatic kids and diabetic kids and other issues. So with the 400 kids on home and hospital care, the state was beginning to realize, well, what's going on in the school? Why are these kids, there was one child at a different school that twice had to get airlifted off the school grounds after she entered the building. She was a kindergartner, so it was a serious problem. And that really, I think, was the motivation to getting the law going.
Mhm.
And, but then like in 2002, we knew like 10 years into this, we knew that it was being misinterpreted. So on November 7th of 2002, our Attorney General's office wrote a letter of advice to MDA about the misinterpretation of the MDA of the statute in regulation. And then it took till 2010 before MDA finally issued an errata sheet, a one-page sheet that said, oops, we didn't quite interpret it right. So in all this stuff, just read this errata sheet and take this into account when you read the manuals, But since then, and with the COVID pandemic, where the EPA, there was a lot of space spraying of EPA registered pesticides. So even though our law requires notification when an EPA registered pesticide is space sprayed, MDA said, no, those are just disinfectants and we don't cover disinfectants for cleaning. So go ahead and space spray all you want with your EPA registered pesticides. We're not going to notify or control that. And they use things with quatsin and all kinds of things, and they're still in use. So, we continue to run into this thing of the interpretation of the law and whether or not it's actually protecting the kids. And the data is never collected or reviewed by MDA. So we don't have a collection of what was actually used. And over the years, MDA has actually weakened the law. It used to be that school systems, like when we testified on the bill back in '97, we had all the pesticide applications the school ever did, and at least 10 years worth, which is why we knew they had sprayed Chlorphorifos for over 10 years. Well, MDA has quietly worked to weaken the law, and in 2011, they reduced the time that school systems have to save the records to just 2 years. And then they never asked for the records. So after 2 years, the records just don't exist. And MDA never took possession of them, making them accessible to parents or commissions or anybody else to look at, because they don't exist with a state agency. So neither the school IPM plans nor the school pesticide application records have been publicly accessible. And MDA has approved some plans that allow for the use of banned products such as Chlorphorifos in the currently approved plans. So, that's pretty distressing, because even in our state, Chlorphorifos or Durispan is banned, and it's still listed as an acceptable option in some of our school IPM plans. So I mentioned then that, we got the health and all policies work group through the state mandate, and then that emphasized and shone a light to CPAC on the role CPAC, the Children's Environmental Health and Protection Advisory Council, then began writing a series of letters asking MDA to address the findings from the health and all policies report. And there were hearings over the years in Annapolis where the senators and the legislators got to hear about pesticide regulations, and it just raised a lot of red flags. So last year, the Joint Chairman's Commission issued, and that's where the House and the Senate have a joint commission, issued a request for an IPM in schools report from the Department of Agriculture. They wanted a copy of all the plans. They wanted to know what the state was of IPM in schools. So that's how we got into this intense review that we have done, which was applauded by all of the, advocacy groups and environmental groups.
Great. A lot of information. I have a couple follow-up questions for you. First, you mentioned Chlorphorifos is still used.
No, I said it's still on the list of acceptable pesticides, even though it's supposed to be only low risk.
Okay. Did the recent EPA decisions change that at all, or that hasn't affected?
It should, but the point is the plans have not been updated. So if an operator goes in there and says, oh, this is really nasty, and I would like to use Chlorphorifos, according to his plan, he can use it. It hasn't been updated for the fact that the EPA has banned the product.
Okay.
So our point is that there's not an annual review of the pesticides used. And, every year new pesticides are introduced and safer ones are introduced, and new IPM procedures are introduced to eliminate certain pesticides. So without reviewing the data of why do schools have to resort to a chemical means, that's the red flag that says, is there something we can do better with exclusion or better practices to eliminate that need in the future? Because, the goal is to not resort to that point where you have to use a pesticide.
Mm-hmm. Yeah, and so you mentioned that there's not a review for the pesticides used in the initial law. Was there a clause for having a review of the pesticides used?
The law says there should be an annual review of the IPM system, which means reviewing not only the plan, but the reasons.
Mhm.
And that review isn't being enforced. And then based on that review, if there are changes to the plan because they learned something new or a pesticide's been banned, they're supposed to update their plans. And some of these plans have never, ever, ever been updated since 97 and the 90s. And some of them, the IPM policy that they mentioned is the policy before the law. You know, some of them, their drafts were written before we even had the law. So
Mhm.
many of the plans are obsolete.
And who is supposed to conduct the annual review based on the law?
That's supposed to be happening within the school system. So the school system's supposed to be reviewing their plan. So here's a great example. We passed a law in 1997, but then in 1998, we expanded it to the grounds. So by statute, you now have to expand your IPM policy, the regulations. Those are from the elected Board of Education. That's public information where the elected board, if there's a law that comes out, they have to issue a public policy and have hearings and come up with their system. And that's all supposed to be public. And those are two components of the law. And then the Department of Education, which is the agency, they write the plans based on the elected Board of Education's policy and system overview. So many of the plans on file with MDA are simply a 4 or 5 page system overview. And embedded in that, it says the plan will be developed based on this overview once approved. But they never actually wrote the plans that they were required. There's supposed to be a policy, a system overview from the Board of Ed, and then a Department of Ed plan. And then when the law changed in 1998 to expand it to grounds, 75% of our schools don't even mention grounds in any of their documentation, and none of them have a full grounds IPM plan that should have been written in 1998 after that law. So, and that's all supposed to be enforced by our Department of Agriculture. So because the Department of Agriculture is telling the school systems, no, you guys are fine. Even at yesterday's CPAC meeting, the Secretary of Agriculture came on and said, all of our school systems are in compliance. We're all doing great. But when you look at the data that they had to submit to the legislature of the actual plans, the data tells a different story. And that's the struggle we're having between the commission and the advocates, that, you know, what MDA tells everybody. And once you pull the curtain back and you look at the actual stuff, which is all publicly posted now, so everybody can look at it now, you know, the data tells a different story.
Yeah, going on the data, I know this review is, this review of the IPM policy in Maryland, it's still ongoing, correct?
So we issued our findings, and I will send it to you. They were made public at the summary of findings was made public at the March 21st CPAC meeting. And so they are now public record. And at the last meeting, we came up with the 5 priorities based on the findings. So I know you can't see this, but all the yellow highlights, these are all the school systems, and then each column is a different component of the law. And where it's yellow, it means they're lacking that component or the component's incomplete. So you can see that there's very few white areas, and most of them are yellow areas where it's either missing or incomplete.
Okay. Could you clarify those 5 priorities?
Oh, sure. And I will send you a copy of that status report from yesterday's meeting, because it was presented at yesterday's CPAC meeting, so it's now public. I believe you have a copy of it, Lorelei, and I copied you on my public input. So just the 5 action items that came out of this review is one, that CPAC should send a letter back to the legislature. The legislature in their request to MDA said they were supposed to consult with CPAC on this, but CPAC didn't have access to the data until after it was made public on December 1st. So we couldn't really be part of that review until after it became a public document. So the first thing is that CPAC should write the legislature and say, we appreciate that you express concern. We have concerns. We know that there's areas that need improvement, and here are our findings. So first of all, there should be a letter in response to the legislature's request because we're a state mandated commission. The second one was clarification of the law's components and state agency requirements. So the Attorney General, we would like his office to go in and review the law with MDA and each of the components and explain exactly what the requirement is for each component. Because MDA has said that they mix up whether you have a plan, a system overview, or an IPM policy. As long as you have one of them, we count you as being in compliance. Well, that's not what the law says. The law says you need all 3. So there needs to be clarification of the requirements for each component in what MDA oversees, but also under the education article, there needs to be clarification for a Board of Education that this law has been here since 1997, and by statute, they need to write the policy and the system for that, because only 6 of our 24 school systems actually have a Board of Ed policy on this law. 6 out of 24 after over 20 years. So we need clarification. That was the second point. The third point was what we touched base on, is identifying and reviewing resources, including reviewing the existing IPM school resources and training materials that are posted on the website for school systems to keep in compliance. So all of that needs to be updated and reviewed. And during COVID, we had some next steps because the EPA and the CDC, everybody was coming up with new procedures to deal with a pandemic and an airborne virus. So we have a step in there that the plans need to be reviewed to see if they're fully in compliant with CDC and EPA requirements on how to deal with a pandemic in school. We know putting up those shields and spraying quats with space sprayers on school buses and in classrooms isn't the way to deal with this pandemic. So the plans need to be updated based on CDC and EPA and health department requirements for dealing with airborne viruses that need EPA registered pesticides or disinfectants to kill the airborne virus. And so those updates. And then the fourth item was the specific items from when the work group that I was working with, because I'm a former commissioner, but I still work with the work group doing the on the ground work. We had met with some of the actual IPM coordinators, all of which who think they're doing that, they are trying hard, and they think based on the feedback from MDA that they're doing everything right. And they're very excited to share what they're doing, and they're very enthusiastic, and they think they're doing it right. So it's a lack of training there, and it's not their fault. You know, they're doing the best they can based on the feedback they're getting from MDA. So we came up with a list of just short action items like educating of parents and school systems on the importance of IPM and the actual components, assisting MDA with updating the content on their website and the training and that kind of stuff, ensuring that school IPM plans that indicate they're to be developed, or they haven't done the grounds plans, that all gets updated, and to consider ways to enhance school construction policies. And this was the exclusion issue, because a lot of the schools are treating for termites, because after construction, they leave all that wood underneath like the main entrance, and they all get termites, by their main entrances. So updating for exclusion practices under IPM. And then the last point under that was encouraging school boards to make IPM plans as well as the application records readily accessible to the public. And then the final action item was to go in and take a look at things that go beyond, what do we have to deal with in terms of indoor air quality, especially after the pandemic, where IPM processes, which are directly tied with green cleaning, like Maryland does have a green cleaning law as well, so that you're introducing safer things, because if you do good green cleaning, you have less of a need to control pests because you're already keeping the building clean. So we see those as tied together. And the last item was to review all of that to see what else we can do to improve the indoor air quality and the whole school environment. So that's what came out of the review, and I will make sure you get those copies as well. And they were presented publicly. The Excel spreadsheet was presented at the March meeting and should be included in the minutes posted publicly. And yesterday's status report was also made public.
Thank you. Earlier on, you mentioned that the law was kind of motivated by this 400 students recommended or approved for home and hospital care. Can you just clarify what institution or who makes that determination?
Sure. So if you have a child that goes to a public school and that child can't tolerate the building or be in the school for whatever reason, for either an accessibility reason or because something in the school is making them sick, they are entitled with taxpayer money from the school system to have something called home and hospital care, which means they have something that's preventing them from being educated in the public school that's assigned to their residents. So they get a private tutor in their home or at the public library or at their church, any place else, and they get their education through a private tutor. So it happened to be in 1997 when so many of these kids were getting sick. Now, not all 400 were pesticide related, but many of them were. And so we had this unbelievable number of kids being educated by private tutors anywhere because they could not physically enter a Maryland public school. And people started connecting the dots and saying, well, what's in the school that they can go to the library, they can be educated in their home, they can be educated at their church, but they can't be in a public school. What is in the public school that is making them sick and preventing them from being there? Okay. So yeah, and that was only our county. That's not the whole state. That was just our county.
And is that law specific to Maryland or?
It's specific to Maryland.
Okay, specific
the
to
school
Maryland.
IPM law. Oh, you mean the home and hospital care?
Yeah.
Oh, that's state level.
That's state
level.
And
I believe there must be some option like that nationwide, because if your child can't be educated, our public school system, everybody under federal law is it qualifies for a free and appropriate public education under federal law. So that's why the states have to provide public education. That's why we have a federal Department of Education to help the states do it. So under federal law, every child qualifies for a free and appropriate public education. And that appropriate part means if you go in a building and you have to be taken away by helicopter or ambulance, then maybe that building is not appropriate for you and you can get educated at home until we can figure out why you can't be in the building. Mm-hmm. And one of the things we did at the same time as the law is there was a lot of growth in our county. So not only did they, the school where my children were injured, they built a brand new $26.7 million school next to the old building that had been sprayed for 10 years with chlorophus because it was cheaper to build the new building than to fix the old building, which was a windowless building with 10 years plus of chlorophus sprayed in it. And then we opened up a new elementary school and they took all of the kids out of district, a lot of them that were on home and hospital care at the elementary school level, and they were all reassigned to the new school as out of district students, where the parents had to drive them to that school, but they could be educated in the school building where they recognized they had to keep the pesticides out and they work very closely to ensure that they practice IPM.
Yeah.
It's been a long journey.
Yeah, Lorelei, I'm very interested in that home and hospital care. So I think we're gonna research that a little bit more if that's applied in other states. That's a very interesting tidbit. So thanks for that. So you mentioned 6 of the 24 schools have a board that's kind of compliant with the law's components.
Well, I said that of the 3 main components, which is an IPM policy, an IPM system overview, and then the plan that's written, the actual procedures that's written from the policy and the system overview. Of those 3, only 6 of the boards of education actually have an approved and posted IPM policy.
Okay.
And again, 6 of them only have the IPM system, which is again written and goes through public hearing and gets posted. And in terms of the documents then from the plan, again, we saw that all the yellow highlights are all the components that are supposed to be in the plan and how many of the 24 school districts are missing, the components. So
yeah, I always like to have, good case studies and stuff like that. I'm interested of those 6 school board of educations. Is there one that kind of stands out in terms of doing the right thing? And if so, have you shared those resources of that school board or anything like that?
Yes, as a matter of fact, you may be aware of Marcy Harden, who is the IPM coordinator for the Howard County Public School System and regularly does webinars for the EPA on this and is nationally recognized as an expert. She was a member of the Northeast School IPM Working Group. We got her, she used to work at the Smithsonian museums because they couldn't introduce pesticides with some of the stuff at the Smithsonian museums in Washington were very pesticide sensitive. So we're very excited after the law went into effect that we were able to get Marcy into Howard County, and Marcy has been a nationally recognized expert. Marcy and I both sat on the committee that wrote the initial Howard County IPM plan. And that plan was just a starting point and wasn't, it was a good starting point, but it didn't address the health and all policies. It was just a starting point, but it's never been updated. It's still the plan that Marcy and I worked on back in 97, 98. But yes, Marcy is an unbelievable resource, an entomologist, and has really been an advocate with us on all of this.
Great, thanks for that information. We discussed it. I think I know the answer to this question, but I would like to know from you, based on the school IPM law, what from the school districts or the Board of Educations that participate, what parts of the law are most violated by these school districts?
I actually wrote that down so I can give it to you. Okay, so what we saw, and this is looking at a summary of violations that was presented by our Department of Agriculture during a hearing before our legislature on another issue in 2022. So 8 counties, 8 of the 24 counties reported that they plan to develop their IPM plans 25 years into this. 11 of the counties were cited by MDA for failure to notify. So one of the components of our IPM law is if you do have to resort to a chemical means of pest control, not only are you supposed to use the lowest risk, but you have to notify students and teachers. At the elementary school level, it's automatic, but at the middle and high school level, you have to register annually to be notified, or else you won't be. So even given those parameters, 11 counties were cited for failure to notify, which is an MDA recognized violation. 9 of the counties use space sprayers to apply EPA registered pesticides to kill pathogens, but they were not cited by MDA because MDA does not consider that a violation of statute, even though we repeatedly brought it up to everybody that this is a violation when you're doing space spraying of an EPA registered pesticide harmful to children, that you need to give some notice. But that was not recognized. But we have documentation and from 9 of the school systems, public documentation, that they were indeed space spraying, and some of the products that they sprayed contained quats, which are very bad for respiratory systems. And none of the counties were cited for having banned pesticides on their list of available pesticides, nor were they cited for not performing their required annual review. So that's what we saw as, again, when they do the reviews, they don't look at all the components. So that is what's a short list of what the violations are.
And I'm curious, in your first in the development of the school IPM law, but also, these updates and these reviews, have you been looking at what other states have been doing in terms of their state IPM laws? Was that motivation, or did that influence any of the language? Or
you mean when we first did the law?
Yeah, when you first developed it, and then also, let's start with the first development. Was that looking at other state laws, and then, as you've considered to refine and do some of these reviews, the second part is, during those reviews, have you had any inspiration from other state laws?
Well, I will tell you that Maryland is the very earliest, if not the first state to implement a school IPM law. So other states were looking at us. And if I'm correct, there are like 42 states now that have such a law. Maryland was one of the very first. And back in 1999, there was a law introduced at the federal level called the School Environment Protection Act, which would have simply provided for notification. It didn't even really go that much into IPM, introduced on the federal basis. And Maryland was an integral part of that. At the press conference, you'll see Ruth Berlin of the Maryland Pesticide Education Network. You'll see me there. Dr. Phil Landrigan at the introduction of SEPA. And to this date, Congress has never passed a law on the federal level. So many states look at us. And through my work with the Coalition for Healthier Schools, the Healthy Schools Network, and the work, through the Northeast School IPM Working Group and the national effort for that, we do look at other states and what other states are doing and share what we have. So we believe that sharing the information is the best way, to learn and to improve institutionalizing IPM with a focus on health and all policies. So you guys are doing a great job, and we really rely on the work that you guys do. We appreciate that Lorelei has attended a couple of our CPAC meetings so she can understand what it's like when you're boots on the ground. So we believe sharing and transparency is key to solving this problem.
Great, thank you. And now, kind of just wrapping things up, this was a lot of great insight. I'm interested, if you have some additional insights, hopes for the school IPM law in Maryland, or just school IPM in general, in terms of being implementation, your hopes for the direction.
Okay, so I think MDA and the Board of Education adoption and enforcement of the law is critical, so that Health and All Policies determines how IPM is institutionalized in our schools and other areas where children are. And the key to that is actually collecting the data, looking at the data, incorporating, putting on a different hat, not what's the least toxic pesticide that we can use, but how do we practice exclusion? How do we build the buildings to make sure that pests don't come in? And it's very interesting when you look at all these LEED certified, US Green Building Council LEED certified buildings. You can build a whole school and you don't have to pick any of the credits for IPM or green cleaning. And once you build the building, you can introduce your air fresheners and treat the grounds. So people, I think there's a lot of greenwashing in this. And what you really need to do is, it was what we did here in Maryland, say, show us the data, show us the plans, show us how you're complying with the law. And then now we're pushing for fill the data gap. Ask the school systems every year for their application records so we can look at where the need is to resort to chemicals. And we're smart enough to come up with those solutions. And with the pandemic, it really emphasized how important with the mold issues and other issues that tie green cleaning to IPM, children shouldn't have to pay for their education with their health. We owe them a safe environment. If you have, and you guys know this, if you have a healthy environment where a child is not burdened with breathing issues or cognitive issues because they got a fuzzy head or blurry vision because something was sprayed, if they're there breathing clean, fresh air, they are going to be better students. They're going to learn better. And from a public health standpoint, they're going to grow into healthier and productive adults and reach their full potential. So my goal is to remember that the school is there for the kids. And you have to do everything in your power to make sure that you don't cause any harm to those children, that you provide them with the safest environment. And the top of the pyramid of what to protect them from is chemicals that are designed to kill and disrupt bodily functions. So the top of the toxic pyramid is pesticides because their purpose is to destroy and interrupt bodily functions and the endocrine system. So that's my hope.
Yeah, absolutely. And I highlighted in our conversation that fifth recommendation from your review of linking IPM to indoor air quality, green cleaning. That's something that we want to do as well for our evaluations for Green Shield certified. It's not just pest management, it's improving indoor air quality if you're doing it right. So really appreciate those parting words. Thank you for taking the time. I thought this was a great interview, and I think it has a lot of great content for our audience and for our Pest Defense resources. So thank you for taking the time, and
thank you for all you guys do. Really appreciate, the webinars, all those Zoom meetings, and just the work that you guys are doing. We really appreciate you shining a light on this issue and trying to come up with good solutions. And very excited about your training material.
Great. My cat had to join at the end, but thank you for your time. We really appreciate it.
Okay, thank you.